Millions of women suffer with back, neck, and shoulder pain due to the size of their breasts. Many turn to breast reduction despite the fear of scarring. But now, for women of color, a technique exists that can help take the weight off mind and body. The I-Team's Barbara Nevins-Taylor has the story.
I think that I'm too large on the top.
Natanya Phillips, an attorney, isn't one of those women who'd pose for magazines or appear in videos. Natanya's double D breasts on her 5'2" frame became too heavy and her back hurt all the time.
Try, getting a bag of potatoes or like a bag of sugar and strapping it on your chest and walking around with it all day long. It's just extra, it's just heavy.
Breast reduction seemed to be the answer, but Natanya feared the scars.
I don't want the invasive cuts. I don't want the invasive scars. I don't want the downtime.
Natanya found another way. She's here with Dr. Sherwood Baxt. He's one of a growing number of doctors performing liposuction breast reduction.
Remember, especially with the dark skin, there is virtually no scar. There's just a dot of a scar.
Minimal scarring is important, especially for people of color who might form thick keloid scars. Scientists aren't sure why these keloids form, but they do believe keloid scarring is genetic.
We're interested in Dr. Bast's liposuction breast reduction procedures because this past year he did a study of 20 African-American patients, and he says basically they've been scar-free.
We're able to reduce the breast, make these women comfortable, let them run around, be athletic, wear appropriate clothing, whatever it might be, and they end up with a scar that's maybe a 1/16 of an inch tucked up underneath the breast.
So we followed Natanya. Here she is before, and here she is ready for liposuction breast reduction.
Instead of 3 to 5 hours of surgery, it's always less than 1 hour of surgery.
A board-certified anesthesiologist puts Natanya into a soft sleep. After making a 1/16 of an inch incision, Dr. Baxt inserts a wand-like instrument called a cannula to suck out the fatty tissue. The operation takes about 30 minutes. Dr. Baxt reduces the size of Natanya's breasts about 2 cup sizes, and Natanya wakes up a few minutes after surgery.
A little sore, painful. Feel a little heavy in the area.
The pain eased. Here she is 1 week later. She's significantly smaller, but still swollen. When the swelling goes down, she'll be smaller still.
I went back to work yesterday, and people are like, wow, you look so much thinner.
And the scarring?
It's more like a dot under both. So that is like that's another reason why I'm very, very happy. So no one would be able to notice it if I was in like a bikini top or something like that.
Dr. Rosemary Engleton, a dermatologist, says people of color must be careful about serious scarring, even if they've personally never had a keloid.
It's sporadic. It's not predictable. It's something that is, it occurs in families. It misses generations. You really do need to look at your entire family history, not just your personal history of scarring.
After you've checked your family history, make sure that you choose a board-certified plastic surgeon who's done this procedure many, many times. Ask to talk to some of his or her patients to see if they're satisfied. Then let us know what happens. I'm Barbara Nevins-Taylor.